MUSC is what we would call a comprehensive stroke center. And basically what that means is that not only are we a primary stroke center where we can offer care for acute strokes like IV TPA or IV clot busting medications like most primary stroke centers, but we also offer what we call endovascular therapies. And basically what that is that if there is a patient with a clot in one of the larger blood vessels in the head or neck, that we're actually able to go up and take that clot out. There are many different types of strokes, but really the two main types of strokes are hemorrhagic strokes, which is actually bleeding into the brain, either into the brain tissue or into the fluid-filled space around the brain. The other type of stroke, which is the more common type of stroke, is called an ischemic stroke. And this is basically when a clot gets lodged in one of the blood vessels, either the smaller vessel or the larger vessel. Unique services that we offer at MUSC not only include treating acute stroke patients with IV therapies, but we also have 3 interventional radiologists and endovascular surgeons that can actually go up and extract blood clots from the large vessels in either the neck or the brain. They're also trained to treat subarachnoid hemorrhages or ruptured aneurysms, which are bleeds into the brain by going up through one of the blood vessels into the brain and putting platinum coils. Other services that we offer is that our neurologists are fellowship trained in cerebrovascular disease, so highly specialized neurological care. We have a neurointensive ICU where we can care for all patients with all sorts of brain injuries, but specifically hemorrhages, ischemic stroke, subarachnoid hemorrhages. Our nursing staff, especially in our neuro units, including our step-down unit, which is our post-stroke unit, are specially trained. They get an additional 20 hours a year just in stroke. So not only they great nurses that take great care of patients, but they're specially trained to take care of neuro patients. We collaborate with 14 other hospitals around the state of South Carolina. What happens is we have sort of like a computer on wheels, and basically they roll it to the patient's bedside. If the ED physician or nurse suspect that a patient's having an acute stroke, they can actually call our ETC or our MIT transfer center, initiate a reach page, and basically the page goes out to all of the stroke physicians here at MUSC. One of us logs onto the computer. We're able to interface with that emergency room physician and nurse and see the patient, review the imaging, review the laboratories, vital signs, etc., right on the computer, right through the internet. So it's real time, and we're able to give feedback, recommendations for acute stroke treatments, and so on and so forth. We're able to speak with family members, speak with the patient, discuss the case with the emergency room physician. It's a two-way camera system, so they are able to see us just as we can see them. And then we talk through their telephone. We actually use sort of a speakerphone that kind of lays out right next to the computer so they can hear everything that we're saying, and we can answer questions as they come up.